Hi, everyone. I am so thrilled to have the opportunity to talk today to Dr. Mario Martinez. I want to tell you a little bit about him, actually, directly from his own website, because I think it's the most powerful introduction there could be. It's so provocative. So, Dr. Martinez is a clinical neuropsychologist, and in 1988, he developed his theory of biocognitive science, which is based on research that demonstrates how thoughts and their biological expression co-emerge within a cultural history. So I'd like to spend a little bit of time deconstructing that because this is music to my ears. And I was joking with you that we connected several years ago, actually, and I read your book at that time, Mind Body Code. And I remember enjoying it and finding it to be important. But I just personally wasn't ready for the profound nature of your message. And I had to move through, many layers of stripping, I guess, my own blocks and, embracing a kind of complexity that you have an incredible handle on. Such that in rereading the book just a couple of weeks ago, I was telling you that I was on the train and I couldn't even read it because I didn't have a pen with me. Like I've underlined almost the entire book, and the experience of reading it without a pen was so painful that I chose to hop on my computer instead. So it's with great pleasure that I'd love to sort of explore some of the topics that you, I believe, have pioneered. And while we both have been deep in a literature referred to as psychoneuroimmunology, and many of the people listening are familiar with that term, I'm sure, there is something missing, in the research that looks to move beyond the Cartesian mind-body dualism, right? It's wonderful that research has existed for 2 decades, but there's still something missing, and I think that's really what you bring to the table. And I want to read a couple of quotes from your book, but one just to sort of launch us into your work. You refer to this as the mind-body code, and we're going to talk about what that is. But you say the mind-body code is the language you learn from your culture that enables you to interpret your world, shape your self-concept, and find meaning in what you do. So what you're telling us, in essence, is that we have to start to pay attention to cultural context. So, the way I think about it is like, okay, so we're finally waking up and realizing we're not asleep, that we're in a room. But then we have to realize that the room is in a house, and that the house is in a neighborhood, and the neighborhood is in a town, is in a country, is on a planet, right? So you're sort of helping us to zoom out, and more than just giving us that sort of the language to ascribe meaning to our illnesses and symptoms, you're helping us to engage in pathways to change, right? Because you would think these are so embedded. What do we do about it? So I'd love to hear a little bit from you by way of introduction about how and why you ever wanted to pursue something beyond just this mind-body concept, right? Which has now become so pervasive that it's almost a cliche term. Why did you want to move beyond there being just a relevance to the mind and the body as a neuropsychologist?
Well, it's always, thank you for having me. I'm a fan. It was moving out of frustration. What I learned in neuropsychology was the pathology of the brain. When there's damage in one area, this is how you get the limitations. But I wanted to know what happens. What are the horizons of the brain when it's normal? So I thought that I should study the people that are best at it, which is the centenarians, but healthy centenarians, people who are over 100, but who are healthy, cognitively intact, and some of them are living alone, and then developing a theory from there. But I came in with the thinking that, okay, it's going to be genetics. That's it. They have a genetic endowment, and that's how it is. Well, after studying many in 5 continents, I found that only 20% is genetic. The rest is what I call the cultural or the biocultural components of it. So I had to develop a whole theory, a whole paradigm to be able to understand them because, as you said, the Cartesian does not at all. The reductionist does not at all. So I had to come up with the mind-body code, and then later, of course, the mind-body self to see how the culture affects it. But with the mind-body code, the thinking was that I asked myself, why is it that if people know, they're intelligent, very functional people, they know that they're doing something that's hurting them, and they keep doing it? Why is it that if the intellectual doesn't work? And what I found was that there's some very embedded things in the person's consciousness that actually, even if they wanted to, they couldn't, because they learn in clusters. So, for example, if you do an affirmation, the best way to explain biocognition is with examples. You do an affirmation and you say, "I'm a good person. I'm a good person." It's not going to do anything, yes, because you have a whole set of archives that tell you you're not a good person, because if you're trying to be a good person, it means that you don't think you are. So the brain needs evidence. The brain needs evidence. The neuromaps cannot change intellectually because you have a cluster. The way to explain it, I think, is something happened to you. Let's say that made you feel unworthy. We store the information, the cognition that was happening, what the immune system was doing at the time, what the nervous system was doing, what the endocrine system, and the context. So that's stored in different parts of the brain and the body in a fractal way. Then all of a sudden you want to change that and say, okay, no, I'm not a bad person anymore, I'm good. That's only taking a piece of the cluster, and it's not taking the rest of the cluster. So therefore it doesn't work. So how can you do it? Very simple. I spent about 15 years trying to create from complexity to actually applicable things. Well, you can say, all right, I'm a good person, like a mantra, I'm a good person. And what will happen is then you have to embody. You have to pay attention to what the body is saying, and you'll find that there's some dissonance. You're going to feel some tension around your chest, or some tension around your stomach, and your body's saying, this is not coherent. My bioinformational field says that I'm not a good person, yet you're telling me I'm a good person. So what you do is you pay attention. All right, I'm a good person, and you get that tension. And then the mind-body code to get rid of that is not by saying, I don't want to be tense, by observation, observing. And observation is the mind-body code to reduce and relieve something, but not with an intention. I'm just observing what's going on, like watching a cloud, and that's the mind-body code to release it. You release it, and then you say, I'm a good person again, and you do it. Then you have to go to your archives that say, since you have bad person archives, you also have good person archives. And you go to the memories, and you do this under a level of contemplativeness or relaxation, so you can, so your brain turns off. And you say, okay, when was I a good person? And you can go back as far as you want to. Oh, I remember when I was 15, I was really good. I did something really good. You bring it in, and you embody that. Where do I feel that? What's the signature for a good person? What's the signature for a bad person? And you keep doing that over and over. And the exalted emotions, the more evolved emotions, will always overcome the limited emotions of fear. So one will recontextualize, but then you don't stop there. Then you say, okay, now, how can I create evidence, more evidence that I'm a good person? And for that day, you make a commitment that you're going to do things that you consider to be good, and you embody them. And the last part, see how complicated it is. The last part, you look at the co-authors, the people that created that reality with you, that are still buying into you not being a good person. Like somebody says to you, well, you're not good with directions, and you buy it. And then one day you're good with directions, and you say to your co-author, hey, I really found myself around. Well, that's just you're lucky. You're not good with directions. They bring you right back. So those co-authors, you set limits with them, and then you go to the co-authors and you say, I really feel I'm a good person. That person says, you are a good person. I see many good things in you. Those are the subcultures of wellness that you create. So just to change one thought, look at all you have to go through, but it's very functional. You know exactly what to do, how to navigate it.
I mean, to me, this is profound. I mean, we were speaking about how, I certainly have sort of stumbled into a methodology for healing that seems to be predicated on, physical healing first before spiritual exploration. And part of why I think that can sometimes be important is just to cultivate the experience you're talking about of trust in the body, identification with a body that can heal, can change, so I talk about how I feel it's important, to sort of quiet symptoms of, indigestion or headache or fatigue, so that you actually have a sensory relationship to your body and can begin to do this kind of work of truly coming into reunion with it. But why
Yes.
I find, your work so profound is because, we were talking earlier and you were saying that you've resolved symptoms of fibromyalgia in the space of a month and a half. And to me, that just goes to show that there's a core thread that these different methodologies share. And it seems like that thread has a whole lot more to do with mindset and, sort of deeply embedded beliefs than it
Yeah.
has to do even with what you're doing. Even the ritualistic procedures you've come up with or I've come up with. It seems like perhaps healing modalities that have lasting, transformative effects, maybe what they have in common is a means and a method to shift mindset. And
Yes.
what I love about, sort of what you offer is that you create an entire language to support this process. So I wonder if you can talk to us a bit about this idea of a cultural editor and this notion of co-authors, because I think to many of us, we understand that different cultures are different and they have different, sort of approaches. But just how different are these, different cultural perspectives, and how relevant is that to our belief system? Because it's far beyond what you believe about health, wellness, and illness.
Yes.
It's really about, sort of the beliefs that have been handed down to you and that are maintained by the culture that you're in, right?
Yes. Yes. Well, if you talk to a reductionist scientist and you say, look, a thought can change biology, and they're going to say, oh, come on, you mean you're going to talk to the cell? No, you can't. But here's a developmental process that you can see why it happens. We're pre-designed, we're not programmed because we're not machines, but we're pre-designed to pay very much attention to the culture editors. And the culture editors are people that are given power by the culture in a context. A doctor in a hospital, a mother at home, a father at home, clergy, and we're pre-designed for that. So what's the first thing that we do? We're hungry and it hurts. And you have a cluster of psychoneuroimmunology. You have emotions that have hormones, and you have the nervous system. In that cluster, you're hungry. Then you see a breast or you see a bottle, and somehow that's relieved. That's another cluster of endorphins and oxytocin and all these other things. So these are clusters that are archived. So you don't have, it's pre-language. You don't have a language. But ladies, oh, so that's a breast. Oh, this is a bottle, and this is mother. Pay a lot of attention to mother. Then you go to a teacher, and you go to another one. And what happens then is anytime that you have a culture editor, you will have either a placebo or a nocebo effect. You either have an effect that is healing or one that is negative. Like, for example, when you're told that, well, you have 6 months to live. That's terrible to say because that's an average, turning it into a sentence. So the co-authors are the people that actually co-create a reality. We can't create a reality in a vacuum. You have to have a co-creation of a reality. And it's relative because we know that they're men because they're women. So it's a relative kind of thing. And I think that the brain has what I call it's an incomplete relativeness. And the reason is so that it doesn't have to update with software. We haven't updated our software for 80,000 years. That's even better than the apples that I love. Why? Because the brain, if you look at it, analogy, because it's not a computer, but if you look at it as a computer, thoughts and emotions are the software, the hardware is the body and the brain. Well, we're a computer that can actually change the hardware with the software. There's no computer that can do that. For example, in London and other places, they have street names. It's very hard to find. It's not First Street, Second Street. So you have to really, really learn and contextualize that information. The part of the brain that deals with that is hippocampus. So what happens with taxi drivers? They have a bigger hippocampus than other people because they developed it. So you see, the software, the outside, the epigenetics can change the brain. So that's good news.
Yeah. It's really in the service of empowerment. I think that's,
Yes.
what both of us, I think, grapple with is that when you suggest that this change is possible, all of a sudden there is an indictment of an
Yes.
entire sort of medical paradigm that is invested in the gene model of illness, and that, implicit in that is that it's not your fault. There's nothing you can do about it, and thank God for pharma, right? So what you're suggesting, and of course what I've been passionate about for many years, is that this change is possible, but there is a radical responsibility that has to be taken for your experience in
Yes.
order to engage that change. And in fact, you talk about this notion of belief horizon. I love that concept, that there is a discomfort that comes with bumping up against the limits of your belief system. And it's actually in that confusion, I think you say, sort of in that discomfort, that real change has the opportunity to take place. So this process is not meant to be easy. It's not easy.
We're very complex, and I think that also, without looking, because you're right, this is an extremely important point that you bring up about the helplessness and the fear of blaming yourself.
Yes.
The way that I look at it, and not everybody wants to change. There are people that don't want to change. I look at it, of course, there's a genetic predisposition for everything. It's there, but it's only a predisposition. It's not genetic sentencing. The way that I look at it is, it has an illness at the beginning has a function, and cultures love to support illnesses. If you say, "I'm going for a walk," and somebody says, let's go to the movies," and you say, "No, I'm going for a walk." Come on, go to the movies. But if you say you have a migraine, it's okay. You don't have to go. You get a pass. So illness is a really powerful passport. So then what happens, I think any illness with different degrees has two functions. One, to avoid something you don't want to do. And the second, which is even more subtle, to avoid something you don't want to do because you don't feel worthy of it. So it can be with good things. And you see a lot of people sabotaging. They work hard all their lives, and they go to Florida to watch the sunset. Six weeks later, cancer or dementia. That's not biologically coherent. So it has those two functions, and you want to be able to look at it without blaming. You say, okay, now if I didn't have this illness, what could I do that I want? And if I didn't have this illness, what would I have to do that I don't want to do? And that's where you get the co-authors, and there are people that, and again, it's not a conscious process, so you don't have to blame yourself. It's just the cultures teach you to become powerful with illness and powerful with helplessness. So therefore, you have to become an outlier. An outlier. Now, but here's what happens when you become an outlier: the culture within the pale will punish you three ways. They'll either abandon you, they'll betray you, or they shame you. So you have to be aware of that. And I've worked with a lot of country music stars and people because I was living in Nashville. And many of them, when they get out of the pale and they go beyond the pale, it even has a negative connotation. And in my case, going beyond the pale is great. So they'll go, and at first they're the heroes. Oh, we love you. We saw you on this and that. After a while, then the implicit thing is that if he could do it or she could do it, I can too. So therefore, I have to bring him down. And then they say something like, "Oh, so you finally had time to see us. You're too big now for us." And they start beating them. Some of them, what they'll do is they'll lose their money with bad investments. They go into drugs and alcohol, and then they come back. Then the culture loves them. "I told you you shouldn't go to Nashville. Stay with us here. We will take care of you." So you see, it's a powerful forces that are working against you. But once you know them, then you give people permission not to like your limits. And that's the key to assertiveness, I think.
So, basically what you're depicting is that there is a tremendous degree of courage required to pursue a kind of healing that would allow you to fully manifest, your gifts, your purpose, your creativity. That there is a resistance that we have to move past or through.
Yes.
And, I think you referenced it just now, but I want to make sure that people have taken this in, because I find it incredibly powerful to have this language. You talked about these archetypal wounds, right, that are potentially inflicted by different cultural, settings, I guess. But there's abandonment, shame, and betrayal. And sometimes in some people, one of those wounds may be more dominant as a driver of behavior than another. And you also talk about them having complementary sort of healing field. So can you just
Yeah.
elaborate on that a little bit? Yeah.
Yes. If you look at the way to look at these three wounds, they even have, I think, a psychoimmunological component to them. So, for example, shame is or let's start with abandonment, which is the most primitive. Abandonment, if you abandon a child, they die.
Yes.
You can't shame a child until they can see themselves in the mirror and say, that's me. They don't have a me, you can't shame them. And then the most sophisticated is, of course, the betrayal. But abandonment initially feels cold. You have a retraction of your vascular system, and you feel cold. It's a protection against some kind of a fight or flight kind of thing. And you feel cold, and you feel a tremendous sense of isolation. The main emotion is isolation, but it's cold. And there's a psychoneurological component going with it. Then shame feels hot. It's different. It feels hot, and you feel like you want the earth to swallow you. And shame is the most studied, and it causes inflammation. Then betrayal is also hot, but anger is the salient emotion, because betrayal is basically a trick. You've been tricked. I'll give you this if you do this. Oh, I'm not going to give it to you. You can do it to a child, and they'll cry and they'll get angry. They're not going to be ashamed. They're going to be angry. But the healing fields are really the good news. The healing field for abandonment is commitment consciousness to you, commitment to you. And I'll explain in a minute. Shame is honor consciousness to you. And betrayal is loyalty consciousness to you. And we know that especially the shame causes inflammation. So what we're doing now is working with fibromyalgia and with rheumatoid arthritis, using honor as an anti-inflammatory agent. So that's pretty powerful stuff. To reduce the interleukins and tumor necrosis factor and other kinds of things. And I'll give you an example how to apply it. Because people think that, you have to be honored with someone. No. Let's say you go into you're an executive and you go into a board meeting, and somebody says, you're late, and somebody says, well, I can always count on you on being late. And all of a sudden you feel this overwhelming sense of anger, because later as an adult you get angry with all three, but not initially. So you feel this anger and overwhelming feeling, and you know that you're dumping your history of the wound on the moment. So you stop, you embody it. Where do I feel this? Okay, my chest is really tense right now. I take a deep breath. What is the honorable thing that I need to do right now for me? And it could be that you're going to wait till the meeting is over to talk to this person, or you could say, look, I'm late, but I think that we need to talk later because this is not acceptable. Whatever you consider to be honorable. Immediately, you're changing the psychoneuroimmunology of the inflammation to something that is empowering, is anti-inflammatory. We've been able to show it clinically, but beginning to study it now at the immunological level so we can actually measure the immunological change. So those are examples of what you can do. And many illnesses, as you know very well, and you argue correctly, are inflammatory, including depression. It's pro-inflammatory kinds of things. So it's good news.
It's you had a very, I think, provocative almost sort of opinion on forgiveness too. I read about,
yes,
which I was reminded of it even in that example where I would say the vast majority of the women that I work with have histories of trauma and sexual abuse. It's sometimes really extraordinarily violent and seemingly life derailing. And this notion of being thankful, to their perpetrators to be able to grow from the experience is really anathema, right? And they can't access that. It's not helpful, even if it sounds like a spiritually high, vibration exercise. And, so you sort of turn it on its head. And again, you recenter the person, right?
Yeah.
And you say, there's a way to actually express gratitude to yourself as a means of releasing or forgiving.
Yes.
Right?
Yes, yeah. Yes, because I'm glad you brought that up, because that's a complex one that I also, out of frustration, people would say I'm Christian or I'm Jewish and I forgive. It doesn't work that way. And I think what happens is that if you look at it, we're bioinformational field, and there's a world out there, and then there's that world that we weave, and we have to resolve it within that world, not outside of that world. Yes. And there was an experiment that was done where they had women go to the perpetrators in prison, and sociopaths will say anything that you want to hear, and they would hug them, and after they get angry with them, they would hug them, and I forgive you. 6 weeks later, panic attacks and all kinds of problems because it wasn't real. And the way they stopped it is that there was a sociopath who was probably more honest than the others, and she said, so what do you have to say for yourself? And he said, well, that when I get out, I'm going to rape you again. And all of a sudden she gets angry, and all of that forgiving was done. So it doesn't work. So the way that I look at it, I see forgiveness as a liberating act of self-love.
I love that.
It has nothing to do with the other person. In fact, the other person continues to be a perpetrator. And you can have forgiveness with reconciliation or not. So what happens then is that if you never thank the person, as you said, you never thank the person for what they did. They continue to be what they are. But what you do is you find out what wound did this perpetrator cause, because you have to know how to fix it. What bacteria, what antibiotics, same thing. All right, so let's say shame. This person disempowered me with shame. Then I have to empower myself with honor. But what you do is you do the technique under a level of contemplativeness, and then you bring out the time of when it happened, and the person's going to feel the shame, and you embody it, the same technique, you embody it. Then after you embody it, you breathe to it, and you pay attention to it so it'll go. When it goes on its own, then you bring a situation of honor that has nothing to do with the perpetration. Nothing. It's just honor consciousness. You bring honor consciousness and you experience it. Once you experience that, I call that the alpha event, which is I feel that although I have been hurt, I continue to be empowered. I am still an empowered person. Nothing to do with the perpetration. And that is that's the alpha. The omega event is when you feel gratitude for you having the capacity to be empowered with honor. And gratitude is what resolves the process. Gratitude is an exalted emotion that allows you to bring in and assimilate whatever you want to assimilate. And it cleans it out. I've worked with people that have had it for 40 years, sexual abuse, concentration camps, and it works. But you have to be willing to get out of victimhood, because that's a very powerful thing. And for the co-authors that support victimhood. And when you want to, what will you have to give up? Well, I can't talk about my sexual abuse anymore as a way of manipulating people. So there's a giving up. The gaining is that you begin to see people empowered, and you don't have co-authors anymore that say, hey, Kelly, how you doing? So how are you feeling today about the abuse? That kind of, is that how I'm so good to see you. I'm so glad you're fine. That's the forgiveness. And I did a workshop at the Galway Cathedral in Ireland, and the Monsignor came over later and said, I'm so glad you did this, because we tell people to forgive theologically and religiously, but we don't give them tools. We don't teach them how to do it.
Yes. That's why I love this, because as a science junkie, you really hit all those buttons for me, where there is a rich scientific literature that speaks to the relevance of meaning, human meaning around illness that we've only ever been told is a random mishap of your genetics and potentially your circumstances in life, and it's just bad luck, and just deal with it, right? So, what you're offering is not only the science to support a more complex narrative, and it is complex. I find it deeply poetic, actually, but it is complex. But you're also offering a totally self-contained. I mean, I'm sure, you work with patients all the time and teach people all the time, but the truth is, you could read your book, learn the methodologies, and do this yourself, right? I
think so, yes.
Yeah, I mean, it could potentially be an exercise in self-healing if you are ready. And the readiness, of course, is all, right? I mean, that's true for any of these interventions.
And what I suggest is to work initially with a healthcare practitioner, and when you feel like you can do it on your own, then you pull out, so that you don't have therapy for the rest of your life. The intruding thought or emotion comes in. All you have to do is stop and breathe and notice where you're experiencing it. Yes. And then get out and look at all the curiosity that you can. It becomes incompatible with the compulsion. You do that 4, 5, 6 times, you get rid of it. It's incredibly powerful by just going into the mindfulness curiosity model.
Right. It's almost like, seemingly the message in there is that when you remember you're connected to something bigger, it's harder to be, overly preoccupied with ingratitude on some level, right?
Exactly. That's the meaning again coming in. Yeah. Absolutely. That's really beautiful the way you express it. That's exactly what's going on, I think.
That's powerful. So I want to leave people with, with a quote from your book that I find so deeply true, and then to be continued, right? So you say, replacing the comfort of known misery with the discomfort of unknown joy can be one of the main obstacles on your path to wellness. And I find that over and over again in my experience that people want to move closer to that experience of joy. They feel entitled to it. They know it's out there, and they have a deep, deep primal desire for it.
Yes.
But the resistance is so powerful, and we make all sorts of excuses for why it's not the time, or how how it's valuable to us to justify our victimhood, and why our illness is meaningful. We make all sorts of excuses, and it's perhaps simply because this joy is such an unknown quantity to us, and the unknown, we've only ever been taught to be afraid of it rather than curious. And so I love that, the comfort of misery to be replaced with the discomfort of joy. There's so many embedded paradoxes in there, but it really is a very deep truth to sit with and ask yourself, are you ready to move into the potential discomfort of that, tremendous exalted emotion? I believe so many of us are, and so I want to thank you for lighting that path. You're just,
my pleasure.
Just an incredibly brilliant mind and a huge heart, and so grateful.
Thank you for your work, because you're doing beautiful work. I want to thank you for that also.
Well, we're speaking the same language, so preaching to the choir here. No, thank you so much, and to be continued. Thank you.